Good morning, everyone, and a very warm welcome to Professor Dr. Rajesh Sagar, the AIIMS team, and all the participants joining us for another session of the virtual mental health series being organized by the CBSC in collaboration with the All India Institute of Medical Sciences, New Delhi. Each day in this series has helped us to take one more step towards understanding the many dimensions of mental health. As we engage with experts and educators from across the country, the message remains clear. Mental well being is not an isolated goal, it is the foundation for learning, growth, and a meaningful life. Today's session focuses on an issue that demands our collective attention: high risk behavior in adolescence. Adolescence is a time of immense change, physically, emotionally, and socially. Curiosity, peer influence, digital exposure, and the struggle for identity often make young people vulnerable to behaviors that may harm their health, safety, or well being. Understanding these patterns early and responding with empathy and guidance is crucial for helping them make safer, healthier choices. It's a privilege today to have with us Dr. Rajesh Sagar, professor in the Department of Psychiatry at AIIMS, New Delhi. Dr. Sagar is a distinguished clinical researcher and academic who has made remarkable contributions to the field of mental health. With an MD in psychiatry, his expertise spans across child and adolescent psychiatry, mental health policy, and many more. He has served as a member of the Central Mental Health Authority and as honorary advisor on mental health to the Ministry of Health and Family Welfare, Government of India, shaping policy and governance in this vital area. Dr. Sagar has also published extensively, mentored several postgraduate students, and is widely recognized for his pioneering work on adolescent mental health in the Indian context. His insights bridge clinical understanding, research, and policy, making his voice especially valuable in today's discussion. We are honored to have him with us to help us understand the underlying causes, manifestations, and prevention strategies for high risk behaviors among adolescents. Before we begin, may I again remind all the participants to kindly post their questions and thoughts in the chat. These will be taken up by a special guest later after the session. With that, it's my great pleasure to invite Dr. Rajesh Sagar to lead today's session on high risk behavior in adolescents. Over to you, sir. Thank you so much for joining us today. Thank you.
Thank you so much. Good morning to everyone. Thank you to Niti Shankar Sharma ji and for your kind words. And I'm so thankful to interact with you, to school principal, counselor, teachers, parents, and most importantly, students who are here. And as you said that my special interest is working with children, adolescents, young population. This is what more than 30 years I have been doing. And so it's always a pleasure to interact and though it is not physical online, but still I will be able to connect to all of them and on this very, very important topic. And I must thank CBSC, Central Board of Secondary Education, to have this initiative on World Mental Health Week. I must my best wishes to all of you on this World Mental Health Week, which is starting from today. And basically, the idea is to create awareness, talking to people. And the most important group is children and young population. I feel that they form a very, very important group. And my thanks to my department, AIIMS, my colleague Deepika, who have been coordinating this activity. I'm sure you will all will learn from this and will be benefited from this. So with these, I will share my screen. In fact,
Yes, we can see it, sir. We can see your screen now.
oh, you can see. Oh, great, great,
Yes, yes,
wonderful,
yes.
wonderful, wonderful.
So just make it full screen,
Yeah,
because it's still.
is it there?
Yes, it's there, sir.
You can see now.
Right,
Okay,
right, perfect.
okay, perfect, perfect, perfect. Yeah, that's great. So okay, so uh, so the topic is high risk behavior in adolescents, and I chose this topic, in fact, for different reasons. In fact, why it is important to all young people, not only young people, but also their parents and teachers, because we don't talk much about it, because we shy away from talking. We only talk of hardcore mental health problem, but and you will realize at the end of that lecture that how important this topic is to all of us. Okay, so this will be the outline, what we mean by high risk behavior. So we will talk about this. Then what are the common high risk behavior among youth, and what are the factors which influence the high risk behavior among youth? So why adolescent go into this high risk behavior, and how to manage also. We will give some tips, some skills, so how that can be managed at different level, like school level, by parents, and by the individual. So I will give that tip to you, and at the end I will keep some time for question answer session also, so that we can have a chat, we can interact. In fact, I like to have more of interaction on one-to-one interactive session, but what I will do, this is online, so I will make a lecture, then later we can have more interaction and discussion after my lecture. So just important definitions were to understand what we mean by high risk behavior. Many of you would know it's a behavior that exposes individual to harm or danger. That's a key thing. That and also which increases the likelihood of negative or adverse health or social outcome. So in general, this is what the high risk behavior mean. Like basically it puts individual in the some kind of harm or danger, and that is what we call as a risk, which again puts into the negative or adverse health or social outcome. What are risk taking behavior? Again, these are the action, because this is a behavior which are undertaken to involve certain level of risk and potential negative outcome, but are often motivated by the pursuit of reward, excitement, or peer approval. So basically, that's what, because this is why one indulges in it, because they get a reward from it. There is some kind of excitement which is there, some kind of gratification one gets, or even the peer approval which is there. So that's how this behavior continues. That's what is risk taking behavior. Now we all know, because those who are aware, those who work with the young population, they know adolescents, again, this is the crucial phase of one life. Basically it is in between the adult and childhood. You grow, and there is a rapid physical and emotional growth is happening. Basically a lot of bodily changes are happening during this period. Your bodily changes, your hormonal changes, and also many changes are happening with regard to the psychological aspects or emotional growth also. And there are number of studies, number of theories about this, that what happens during adolescent period. So also it is important from psychological perspective that exploration is normal, in this phase, but may also lead to behavior that threatens one's health, one's own health, safety, and well-being, because exploration is there. And which again, this is leading to may compromise the health or safety or well-being. So that is why it is important to understand this crucial phase, and what the risk it can bring into the development of a adolescent. And also high risk behavior in adolescents are actions, or the behavior that can potentially harm with regard to physical, mental, or emotional well-being. So that becomes that is jeopardized in a way. There is an adversity with not only mental but also physical health also. Their mental health along with that, and also emotional well-being. So this is in general to understand the high risk behavior, and what this high risk behavior mean to us, to put the context correct for this particular lecture. Now the important thing you would be knowing that why we are talking about it, why we are discussing about it. As I said in the beginning, we don't talk much about it. We shy away for a number of reasons, because of many things which we don't want to talk. But I believe that talking about these things is important, generally which are in the closed room, and because it involves sexual behavior and self-harm and all. So that's why we don't talk about it. We shy away from talking. But I think it's a responsibility of all of us that the more we interact, the more we talk, the more understanding it will bring, rather than it is in the closed room. So one of the important consequence of high risk behavior is what we said, is about the health. Health, as I said, like physical, mental, or social well-being. So it is posing with regard to injuries. We'll talk about that more in detail. Infection, HIV, sexually transmitted infection, addiction. Again, that's a very strong thing which can pose, and also even unwanted pregnancies at times, which I would say more a problem of Western country. But yes, in our country also this is happening because of high risk behavior. So we need to be aware of these important health consequences. Then, of course, there are psychosocial consequences also, and that is why we need to talk about it. We need to discuss. One is that overall there is a poor performance with regard to academic performance. There is a kind of because of high risk behavior, their performance goes down. They may fail in the exam. They are not promoted, and which again is a very important thing. And they also may be a school dropout also, which again is very important, because and you may be aware that many children, the numbers goes down after 10th, 12th, and so on, because they drop out from school for number of reasons, and one of the important reason is high risk behavior. Of course, there are certain legal issues also are there. You would have heard it comes up in news sometimes, and there are legal implications which are important. So the whole idea is how we can prevent all this. I think that's why it's an important consequence and after effect of high risk behavior. There may be long term effects, like there may be emotional disorders like anxiety, depression, lot of all those conditions may be there. There may be chronic illnesses also, and there may be overall instability, problem with the temperament, problem with the personality, and overall sometimes they may indulge in antisocial activities, and so on. So I think for all these reasons, now you know that why it is important to talk about it, why it is important, because these consequences are very important. Now coming to the second part, that is what are the common high risk behavior. Now you know what we mean by high risk behavior, and what are the consequences, why we need to discuss about it. So okay, so there are many. I think I will just put in a very simple way the four things you should understand. One is, of course, we talk about substance use. I think, and you would have heard, because this is the age group where one indulges into these activities for a number of reasons, and for many drugs which are one exposes to, and which do have an impact on physical and mental health, or different kinds of substances, drugs, even alcohol, smoking, and so on. So that's a very important aspect, important thing about high risk behavior. Then sexual risk behavior. I think sexually transmitted infections, unintended pregnancy, and which can have a psychological consequences. One of the important aspect of high risk behavior is aggression and violence. I think you all will know how important it is, the fights, the bullying, the self harm, suicidal attempts, and so on, which is a serious concern, and the aggression which happens. So that's an important aspect of the high risk behavior. Then something of the recent time, what we know, the digital interventions or digital risk, like cyberbullying, transmission of sexual content, and internet addiction or excessive use. So all these, of course, there are others also, like school dropout, even truancy, not going to school. So these are all multiple. One can say as a some of the common high risk behavior. Of course, there are many others also. Even the high risk, if you see the definition, even sitting in front of TV for long hours is also high risk behavior, because that will put up a person to the risk of obesity and physical problems and so on. Sitting many hours not doing any activity is also high risk behavior. People have tried to say that sitting idle for many hours is equal to taking so many cigarettes. That is also has its own harm. So there are multiple, but just remember these important tasks, common high risk behavior, and further discussion will be based on this, and subsequent points will be taken from there. Now, as I said, the important high risk behavior is what we know is substance use, and the figures are staggering. That is, age 10 to 19 years in India, 31.5 adolescent use of tobacco in some form or the other, some form, either cigarette or smokeless tobacco. So that's number is, you can see, almost one third, which is so huge on 10 to 19 years. 13% of the drug abuse victims in India are below the age of 20 years. So you can see the numbers, the magnitude is so high. And the survey, the one of the earliest survey done in our department, was 8.5% of the youth from aged 10 to 25 years use illicit drugs like cannabis or substances. So you can see that the numbers are very high. And on the left side, you can see that substance use has doubled in recent time, and this came up, and we all are aware of it. Several admissions happen. We do have a National Drug Dependence Treatment Center at AIIMS, where even young people are admitted. Of course, the reasons are several, like boredom, depression, sudden loss of childhood related activities. Like, now we know that there is no playground to play, not much emphasis given to physical activity. There is a lack of structured school life, which again put individual or adolescent into experiment with the cannabis or alcohol. Now, these are again some of the figures which are there, just to make you aware, and you can see that why this is important. Always when I work with children, always I say that less than 18 years of the population form more than 40% of our country's population. We are a country where predominantly we have a youth population, you can see, and 42% is it's a huge population. But always I say the resources are not in tune to the 40%. So that's why there is a mismatch. And you can see that about 20 million of people, about 2 crore people live in Delhi, and about 2 million, that is 20 lakh, are below 6 years of age. And the important thing is the mental health problem is 1 in 5. 20% of this population, of this 40% which is there, do have a mental health issues, mental health problem, mental health illness, and so on. And substance use, whole lot of tobacco, alcohol, cannabis, inhalant, opioids, sedatives, all types of substances are used by this young population. And also one of the important risks is the street children, and one can see that the onset, the one who starts is 9 years of age, so early. Those who are living in streets, so they are a very, very vulnerable and group. And tobacco use is reported in almost about 75% of street children, inhalant use. And these children, they work also, they are school dropouts, so they are a very, very important group. And we need to be aware. And the important common reaction from the schools are basically they deny about the problem. When we talk to them, they do offer some kind of a punishment, suspension from school, and in some cases counseling or referral or treatment are given, but very less. But this numbers have increased in recent time. But these are some of the responses from the school. Now we come to the something related to sexual behavior. I think this is, again, we don't talk much, but I think it's important that and these numbers are staggering. And these are not my data. This has been published. There is a good evidence to it. Like 47% of the boys, adolescent, and 6% of girls are into pornography. And those who own a personal mobile phone, they are exposed to this. And you can see 1.7 times more likely, while girls are 2.27 times. You can see those who are having a personal phone. 14% of men are engaged in early sexual behavior, and they do have unprotected sex. And so these are all evidences which are there, which all we need to be aware, and we have to see that how we can prevent it, how we can create awareness about all these and those. And there are certain risk factors which are there, like alcohol use, internet use, media exposure, and all these are important risk factor for these behavior. Now 30%, now this is a very important issue, bullying. Always I say, now this is something which has come up in our clinical practice also, like and where one of the important thing, because bullying was discussed in Western countries about 20 years ago, but now we know that in our country too, bullying anyone, like how the seniors, they trouble the juniors, and they put the child into the risk. So bullying is a very, very important risk factor, and the numbers are almost 30%. And based on the studies which are there, they are either a victim or they are perpetrator or they are conducting the bullying. Now in school campuses, sometimes schools say that it does not happen in the school premise, but actually it is important. When we talk to these young people, we came to know that sometime during the school bus, sitting at the back, sitting, that lot of the bullying happen, though it's technically not a school premise or campus, but it is happening during the outside school premise, or even the school bus. So they are some of the vulnerable area, things where bullying happens. So it is a very, very important, because one person is shy about it, but it is a serious mental health implication, bullying. And sometimes it can lead to anxiety, depression, and so on. Lot of mental health issues may be there, even to the tune of suicide attempt. Sometimes low self-esteem and all can be there because of bullying. And you can see that 20% of boys and 7% girls between age of 13 to 19
Okay.
years involved with a physical fight in 1 year. So again, these are very, very staggering. Now, can I continue? Can I continue? Can I continue? Okay, so then one of the important high risk behavior is violence in Indian schools. In fact, we have worked with the NCPCR, National Commission of Protection of Child Rights, Safety of a Child, even the violence. It's a serious concern. Now there are different types of violence which can happen, like verbal violence. Like 57% of students are affected, like name calling, abuse, threats, defamation, insults, and so on. So see the numbers, which are relational violence is 46%, whereas related to the where the victims of the relational violence, where the peer damage the relationship with others, जो उनकी दोस्ती है, maybe their friends, they want to in a way have a fight with them, or they are excluded from the group activities and so on. So that's about 46%. 45% physical violence, like severe acts with the bat, sticks, sharp weapon. Of course they are rare, but they do happen. So that's again almost close to 50%. You can see physical violence. Now one of the serious concern is the sexual harassment. 1/4 of the student experience sexual harassment, primarily due to inappropriate comments, looks, gestures, and of course small numbers reported harassment through inappropriate touching and so on. So you can see the numbers are so high with regard to violence in Indian schools, and this is based on the study which was published just recently. Now, another important high-risk behavior is digital technology usage. I think this is something which has come in the recent time. One can say about 10 years, 5 years, again, because of digital innovations, digital kind of influence we have. So, which again has brought up a lot of the negative effect also. We all know up to 95% adolescents have their own access to mobile phone. And of course, the 21st century, any child who are born may not know the period where the mobile phones or the internet were not there. And in the world over, 70% we see that they do have a social media account. Average spending is around 2.5 hours per day on social media. But the important thing is 90% of teenagers in developed nation use social media, but in our own country, you can see that 85% of adolescent and young people have the access to smartphones. And the most important thing is, on average, again, it's a 5 hours a day they use, so you can see, and 80% admitted to using social media. So you can see the numbers are so huge. And so any program what we do, any awareness and anything, so we have to take care of these 85% users in adolescents using a smartphone, and 5 hours a day, which is a huge number in that way. Now, we do talk about screen time and mental health, and after the COVID, a lot of emphasis was there, especially with the young population also. And you can see the COVID has impacted our screen time, and these are again based on the studies, evidences what we have, and you can see the 16 to 25, 24-year old, and 2020, you can see that 76% people spend more time on mobile phones. 45% of people spend more time on laptop. 34 people spend more time watching TV and so on. 22 more time on tablets, and so numbers have increased after the COVID. And these are on the right side. You can see all the harms which can happen. Now this extends to the youth population, that is decreased concentration or focus or motivation, the eye overstimulation or retina overstimulation, decreased intimacy. Then number 4 is the fatigue, tiredness, a lack of sleep, delayed sleep, and so on. Then vision changes and headache are also reported. And there is an important thing, that is loneliness and isolation, touch deprivation, lack of motivation and creativity, increased stress, which is there due to increased focus on stress-induced media, about a lot of negative news which comes up in different places in the social media or even in the print media. And the techno stresses, they are like symptoms of fatigue, irritability, lack of sleep, mental health effect like frustration, and so on. So all these are affects, mental health effects of the increased screen time, more so in young population. So we all need to be aware of these harmful effects. Now, this is something very important, and which you all should be aware of. And these are very, very important figures from our own country. You can see these are not my data. This has been published. Now you can see the studied in a survey of 11,500 parents and children between age of 10 to 18 years, mainly adolescents, across 10 different countries. You can see India was one of them. And you see the figures, 85% Indian children experience cyberbullying, which was highest in the world. You can see, which is very unfortunate part. But we need to be aware of it, I think. And was done by the cybersecurity McAfee. 85% of Indian children were cyberbullied. In fact, I must tell you that recently the news came of Indian actor's daughter also was affected because of this, because had came in the news. So which is something which is hidden, which is a high risk behavior. We need to be aware about this, which is so serious. And you can see that the numbers again are very, very high. 45% of Indian children said they hide their cyberbullying experience of parents. So, which again, they are not telling all the cyberbullying things to their parents. So many are hiding almost half. 45% said they cyber bullied a stranger, compared to 17% worldwide. So the worldwide figure was 17%, but in India it was 45%. So they said that they cyber bullied a stranger. At the same time, 48%, almost half, said they cyber bullied someone they knew, someone they were aware, and about 45% for the stranger. You can see, and 1.5 times it was more in India as compared to other countries, again, which is a very, very serious thing. And 48% parents said that they have spoken to their children about cyberbullying. Of course, parents are aware about this, but only 48%, less than 50% have talked about cyberbullying to their child. And you can see 3 out of 5, 58% children said that they have deleted a social media account to avoid cyberbullying. Many of these young people have deleted account because they have been sufferer or victim of cyberbullying. 66% Indian children said they are more likely to cyberbully someone they knew, by someone they knew. So, and you can see the numbers. Young girl, you can see the highest rates are there international in our country. 10 to 14 years were 32%, and 15 to 16 were 34%. And these are the forms of cyberbullying. You can see, trolling, personal attacks, sexual harassment, threat of personal harm, and so on, spreading false rumors, and all those things are there. And these are all evidence based, which is there. So this is one of the important high risk behavior. And so my urge and appeal to everyone here is, whether they are school teacher, principal, parents, and students who are here, be aware of this. This is a serious concern, because one, it is hidden, it has a serious mental health implication. So prevent it, talk about it, discuss about it. If anyone who is a victim, should let others know about it, so some measures can be taken. So this is what important message I want to give here at this platform. Then, of course, one of the important high risk behavior we all should know is accident also, because adolescents, young people are, they feel some kind of pleasure in high risk driving and all, and which again the numbers are very, very high in our own country. Sometimes, as compared to other countries, the accidents rates are very high. At AIIMS, we do have a trauma center, and where we also get a lot of young people who are victims there. And you can see the many young drivers, 14 to 15-year-old, tend to drive recklessly and believing speed impresses them to impress their friends, and the fatalities are also there. And over 50% of road traffic accident victims are aged 13 to 20 years. So this is also important high risk behavior for young population. Now, these are different causes of traffic accidents. I will not go into details of all this, like all these high risk behavior which are there, because it can lead to serious injury, even death also. So we important high risk behavior, we need to see that how we can prevent it, how we can in a way take measures so that these accidents can be avoided. Now, these are some of the short-term and long-term consequences of high-risk behavior and road traffic accident, like physical health issues, like there is increased risk of injury or accident, and long-term is chronic health condition like liver, heart problems, and so on. And the physical health, acute health issues like alcohol and sexually transmitted infection. Long-term effect, substance use, and overall health is affected. Emotional and mental health, you can see there is increased anxiety, depression, or low self-esteem. There could be emotional instability also due to peer pressure or substance use. Long-term effect, mental health effects are also anxiety disorder, depression, and so on. There may be social implication like conflict with the parents or guardian. There could be isolation or exclusion from the peer group, difficulty in forming healthy relationship as a long-term effect, and long-term social isolation from peers or family. There may be academic consequences like decreased academic performance, increased school disciplinary action. There is a lower likelihood of completing high school education, and so on. So there are many long-term effects also. And the most important is, because of all this, there could be legal issues like potential arrest or legal action can be done. We have seen the news also where some of the young people are, they are taken into custody because of all this high-risk behavior. Increased risk of criminal activities which may go into adulthood also. So now you know that there are serious short-term and long-term consequences of high-risk behavior. So these are some of the factors or why one indulges into the risk-taking behavior. That is, there are many biological factors which we'll talk about later. There could be early risk-taking behavior. There may be social, emotional, or cognitive, means thinking-related issues. There may be academic difficulties or school dropout. Acculturation stress is those who are going to a different culture. The stress of going to the new place again may lead to this risk-taking behavior. There may be social emotional incompetence. There may be they may not be able to handle the pressure which is there, or there may be they may not have a good friends. They may not have a skill to make new friends, and so on. And of course, impulsivity is also one of the important risk factor for this kind of risk-taking behavior. Then, of course, there are family factors, ineffective family management practices, like where there is a poor disciplining and so on, where the family is not able to spend time with their children, not spending the quality time, and so on. If a child is witnessing the violence in the family or child maltreatment, is itself is an important risk behavior. Then single parent household, poverty in family, again, so these are important risk factors. Then peer factors, because a lot of things are done because of peer pressure. There may be association with the deviant peers, those who have disturbed behavior. Of course, community factors are though where these are likelihood is high if there is a high crime rates or lack of community resources and so on. Now, just to talk, peer pressure plays a major role for this high risk behavior. Now, there is something known as what we call as a power of conformity. The need to belong is important, and they conform to the group norms. If everyone is taking drugs, so they think that they will be identified with that group when they also start taking that drug. Or say recklessly driving also, there is a group, they do that, so they want to identify it. So they feel that if they are able to do this activity, so they will be identified, they will fit into that group, so that is how they will be accepted. So that's a conformity power, that's a peer pressure. Then fear of missing out, that is also a very important thing. Like if one say that if they are enjoying their drugs, then why not I also do it, because otherwise I will miss out on something, or they will go somewhere, do these activities in a group. So they feel that if I don't do this, then I will miss out. So that is why they indulge into this kind of risk taking behavior, and which again could be risk, otherwise there could be a risk of isolation. Social proof, that is something when they think that many people are doing all this, so that must be something good also, that is maybe the correct choice, so they try to. So peer pressure is very important with regard to high risk and the decision making. Now, these are some of the just to tell you, this is a brain figure. Those who have studied the biology will know the brain. One of the teenage brain is very important to know, because it's developing. It's still immature. Like there is something known as the prefrontal cortex. I forget about the name. The whole idea is in adults it's a fully developed. It keeps on developing till 25 years of age. Wherein teens, the adolescents, it's still immature and it's prone to high risk behavior. So what I'm trying to say here is there is a biological basis to it. Amygdala is also one area which is there in the brain, which is for the emotional, for the emotions, for the impulse, for the aggression and fear. So adults, they rely more on the prefrontal cortex, which is already developed, whereas the adolescent, they rely more on the amygdala performance. That is why they are more impulsive and so on. So the whole, if you see, so the adult brain is more developed and mature, so they can take a proper decision, whereas in adolescent it's developing, so they rely more on the passion, more on the impulsivity, more on the risk taking behavior. So the whole idea to show this is that there is a biological or brain basis to all this behavior, and that is why some of the risk taking behavior which is there in adolescent go away when they become adult also. So these are some of the brain development, as I said, like like adults have the developed prefrontal cortex, so that is why they can avoid they can have a control over risk taking behavior, whereas in adolescents still it's developing, so they are more into the emotional responses, more into the rewards, what they get, immediate reward they want. That is why they are indulging into the risk taking behavior. That is why they are into reckless driving, taking substances, taking drugs, and so on. Now, there is also the psychological concept of the identity formation also, because that is, again, to tell you that the identity and the roles, what they get. So that is the time when they start experimenting with the new behavior, exploration, which is the part of adolescent behavior, and a lot of, textbooks are there on this. There is also something independence seeking also, because as a child, they are with their parents, they rely, they are dependent on the parent, but then the autonomy starts, they want to have their own life. So that is why they have the conflict with the parents and authority figures, and sometimes they go against the rules, and they don't want to have the kind of limitation what are imposed. So again, this is a kind of behavior where they want to get away from the shackles of their with the parents and so on. So, and they also have a, as a part of risk-taking behavior, it's a part of the exploratory behavior, which is also a kind of a common behavior in the adolescent phase as the identity exploration. Now, there is something known as emotional regulation also. Like emotions regulation is also a very important aspect, emotional volatility. That is the adolescent experience intense emotions and to regulate their feelings. And that is why this all can lead to the impulsive decision. That is why many adolescents we have to see, they take a very impulsive behavior. They have, which again lead them to into taking more of a risky behavior as a mean of coping and the relief as such. There is also important aspect of stress and coping mechanism. The adolescents lack effective coping strategies to deal with the stress and anxiety, which again there are multiple maladaptive behaviors, maybe there like substance use and risky social interactions and so on. Interplay with the risk-taking, poor emotional regulation can result again to a higher tendency of risk-taking behavior for the immediate relief, immediate feeling they can have rather than the thinking about the potential cause. They don't think about what will happen next. They want the immediate kind of thing to happen. So these are some of the emotional regulation challenges which are there. Now, these are some of the important mental health disorders which are there and which are linked with the risk-taking behavior, like conduct disorder, which is there, forget about the name of the diagnosis, just to tell you that these are all clinical condition, because in our clinic we see all these young people, those who have these problems, those who work with children, adolescent, they will know, many of these children are referred to us. So a conduct disorder is one which is aggressive and deceitful behavior. They have disregard for authority and delinquency and substance use. Depression, again, they self-medicate with alcohol or drugs and increase engagement in risk behavior. Substance use disorder, already I have discussed. Attention deficit hyperactivity disorder also is a very important condition where there is a high risk taking behavior. They are children with adolescent with the impulsive behavior. Sometimes it can be dangerous also. Difficulty with the planning and decision making. PTSD, again post traumatic stress disorder. Then bipolar disorder also is an impulsive and risk taking behavior, is part of the symptoms. And of course, eating disorder is also where they have engaged in the risk taking behavior with regard to body image. They stop eating food. Sometimes they overeat, then they vomit out, and so on. So all these are important clinical conditions, just to make you aware of these conditions. Then there is a whole condition what we call as a high risk behavior, the impulse control disorder. And also, just to tell you, it's basically inability to resist urges, and they may also have regret or distress later on. The key features are failure to resist impulses, what they have, gratification or relief after that. They have a guilt or regret about the behavior that can be recurrent and impairing. There may be other psychiatric conditions also. There are a whole lot of other conditions are also there, impulse control disorder. Now, these are the some of the important conditions. You can see that where the aggressive and impulsive behavior is there, like kleptomania, where the resist to steal is there, pyromania, the urge to set on fire, gambling, then hair pulling disorders, then there is a compulsive sexual behavior, and so on. So these are all clinical conditions which are involved with the high risk behavior. Then there is something known as what we call a non-suicidal self-injury. There's a repeated self-harm behavior without a suicidal intent, like cutting, burning self. Excessive internet use, we all know in the recent time it is a serious concern, like excessive and compulsive use of internet, especially social media or gaming, which impairs the daily functions. Now, these are some of the one of the important condition which we need to be aware of, where there is a where it is the kind of a deliberate self harm without the intent to die, and these are we do get in our clinic many such young people who have these problems, and they have repeated self inflicted harm, and the purpose is for relieving their emotional distress. And of course, the main issue is with them is the emotional dysregulation which is there. They are not able to control their emotions. They are not able to control their impulses what they have. and they involve in the self-injury behavior. Why I'm saying all this is because this is a common condition. I want all of you to be aware of it. We need not, sometimes we take a path of not discussing all this, but I think it is important that we all need to be aware. And it is a myth that by discussing all this, you will increase the chances. No, it is something by discussing all this, you will know that if any one of you have a problem, then you can seek a help. Anyone, if you see around you have a problem, then you can ask a person to go for help. So all these are important, and to make you aware of these things. I will skip this because of lack of time. And there is something which is internet excessive use addiction. We all know is a very excessive use. There is a problem with the control. Then just last point I want to discuss is how we can manage at different level. And basically, because I can see many of you are here, teachers and schools principals, and you play a very, very important role and major role for this. One of the important aspect is promote life skill education. Many of the schools, these activities going on, and safe discussion, we'll talk about that later. Recognize early signs and provide guidance. That is why I have showed you in my earlier slide, all these are clinical conditions where you, to make you aware, to educate you, all of you, that these are all clinical conditions. If it is there, because we all, the dictum is that, identify early so that we can treat effectively over period of the early the diagnosis, early the intervention, the outcome is very good. Child can be a normal child like any one of us. So recognition of early signs and symptoms are important. Collaborate with counselor and parents. Again, it's important. Always I say that the parent teacher meeting is very important platform where the teachers are there, parents are there, even some students are there. All of that can play a major role. And many of the children are referred to us after discussing, when the teacher discusses with the parent, because sometimes parents, they do deny that this child, there is a mode of denial. But later, they know, when they are aware of it, then they themselves asking the child to seek a help. Of course, health education programs are important to remove all the myths which are there, which are prevalent, and so on. Of course, there is also some schools also have a comprehensive sexuality education also. Sometime back in many of the schools, this program was running, providing education of healthy relationship, consent, safe sexual practices, to reduce the risk related to sexual behavior. Substance abuse prevention program, many of the schools, they are aware of this, to educate about the dangers of the drugs and alcohol use, including peer pressure and so on. And life skill education training, as I said, basically what it means is to teach decision making, problem solving, emotional regulation, to help an adolescent to navigate these challenges and reduce risk taking behavior. So that plays a very, very important role, and your role is very, very crucial and important in this. Now, this was about schools and the teachers and the counselor. Now, the parent play a very, very important role in all this. And always I say in my clinic, when I discuss with parents, one of the important things is the parents have to show the positive modeling, like the parents who model healthy behavior and decision making and serve as a role model for the children. And their actions set a standard for what is acceptable. So that's a very, very key, because child is learns from what is there in the environment, what is there at home, what is there with the parent, because they model their parents. So I think that's a very, very key and very important aspect. The other important thing always I say is the communication, because give that environment where a child or adolescent or a young person can talk to their parents. So give that open environment or free environment for the communication between parent and adolescent, for the better understanding and guidance. And adolescents are more likely to share their thoughts and concern with a parent who listen and engage with. I think that's a very key thing, because adolescent young people will know, if my parents are not willing to talk to me, if they do not have a time, if you give that impression as a parent, then they will not talk about it. So if the parents are there who are willing to engage with the child, and also who are willing to listen, then there's more likelihood that adolescent will discuss or express their problem in much more open way. The third is a monitoring. I think, again, keep a check. active parental monitoring is important with regard to their own activity with their friends and behavior. So all these can deter in the engagement with the risk behavior. So be aware, parent need to be aware of the social circles, the environment they frequently visit, and so on. So I think that monitoring and supervision is crucial and important from the parental perspective. And the fourth important thing is providing the emotional support. Again, the child, the adolescent, and what our experience is, when the parents are providing emotional support or giving a quality time, then the adolescents are more willing to talk about it. So providing the emotional support and safe environment, and it is important to discuss their challenges, fears, and experiences. So all these can reduce the feeling of isolation or loneliness, and also can increase the self-esteem. So these are some of the important points. Of course, there are many others so which are important from the parental perspective, and parent play a very, very important and the active role in the management as such, which they can treat and prevent some of these problems. Of course, this is the emotional regulation. You can see, like first, if anyone has a problem, notice how you feel. Then you can say, name it. Are you feeling angry? Are you feeling sad? Are you feeling, irritable? So give a name to it. What describes the best? Then accept it. Acceptance is a very, very key and important thing. Is it normal reaction? Accept the emotion as such. What prompted it? Don't judge. That's a basic thing. We always say to any individual or anyone, don't judge a person based on the behavior what he shows. Acceptance is very key. Then of course, fourth is investigate how intense it is, how are you breathing, what are you feeling physically, and so on. Then the fifth is important, is allow and release. So basically expressing out, release the emotions what they are. Notice and allow your thoughts, release the judgment, breathe deeply, and so on. So this is an important aspect of emotional regulation, more so when there is anger, irritability, anxiety, and so on. Then ventilation, again we always say तकलीफ बांटने से कम होती है, छुपाने से नहीं. Always we say that's a dictum. Develop your support network through your family members, friends, and talk about your emotions. It's not an event that is stressful, but important is how we perceive them. That is more important. And of course, maintain a general right about it. Express your emotion regularly, because that's also a way of a ventilation. So maintaining a general writing about is also a way of expression or ventilation. This is something known as cognitive training. Forget about the difficult word cognitive. Cognitive means thinking. So you can have a worksheet. You can have a risk, you can have this kind of a sheet situation. What are the risks? What could happen, positive or negative? What do you do? Like your friend is having birthday party, ask if you would bring some alcohol, because that's what happened in the young people. She said that you take it from your parent. If you don't bring it, you will not be invited to the party. So you can see, discuss about it. What are the risks, actual or perceived? What could happen, positive and negative? What you do. So in this way, you can write about this, what we call as a cognitive training. And this will help in the further management of the what we call as a cognitive restructuring and so on. Then improving your own self-esteem. I think that is very important. Like encourage the writing or journaling to document positive experience and achievement. Practice affirmation that promote the self-worth and capability. Like you can have a self-esteem worksheet. Like my positive qualities. Always I ask my young people to have a sheet. Always write your positive qualities. Some good things about me are, okay, 1, 2, 3, 4. Positive general date. One positive quality showed today was this. I showed this. Today I am grateful for this. So like this, you can have a improve your self-esteem, or which is self-esteem worksheet. So this can also help analyzing or assessing yourself. That these are coping skills. Coping means how you handle the stress or any situation what you are going through. Like exercise is very important, physical activity, taking a bath at time, giving yourself a pep talk. Also is important that, okay, I am good, I will get over this situation, I will, so all this. And meditation again can be very helpful. Then working on managing time is important. Then asking for support, because we should not shy away from asking a support. Many the problem actually happens We don't tell about our problem. We keep it to ourselves. So help is around us only. Always I say, help is, you just have to ask for support. Establish a healthy boundaries, create a to-do list, and so on. So these are all the mechanism to manage or handle the adverse situation or with regard to high risk behavior. So these are some of the management for impulse control disorder, like psychotherapy. That is because why I'm saying all this, there's a definite treatment to all this, and which can one person can be helped. Like CBT is cognitive behavior therapy, dialectical behavior therapy, family therapy. Maybe in subsequent lecture you will know more details about it. I'm just telling you so that we work with all the evidences what we have. There is a scientific principle to all this. Certain medications are also given based on the impulsive or high risk behavior. Skills and coping are taught, mindfulness, problem solving skill. Support system have to be developed, like support group, family involvement, monitoring of regular follow up, crisis planning, education, creating awareness, and so on. And now, one of the important thing is self-help strategies. I think this is the one thing which everyone can do. You don't need a help from anyone else. Learn about your problem. Knowledge is a power, and so knowing about your own problem, what are the triggers, what are the how it can get better, because you know it best. So that's one thing which you can do. Try habit reversal. Like how you can reverse your habit, a negative habit what you have, by doing some activities you can do this habit reversal. Keeping a journal, as I said, again looking at what made you stressful, what made you to upset, angry, and write about that. Create a plan, what you can do in a positive way, what can bring a happiness or joy, that can be discussed. And again, talking to your therapist or doctor again is a very, very important thing. So self-help strategies play a major role. Okay, so and take home message is high risk behaviors are common in youth population. They have short and long term consequences. We know about it. Several factors are there which influence high risk behavior. Brain development plays an important role. There are many mental disorders or mental illnesses which are associated with high risk behavior, and there are important steps in the management of such behavior. With this, I will end here. Thank you very much. I know we have some time for discussion. We can spare some time, or it is up to you. Yeah, please tell me. Yeah.
Yeah, it has been a wonderful session, and we are getting so many queries and thoughts and sharing of experiences on the chat. I will not take much of your time. I'll just put in one or two queries, which I thought I just address it before we call it a day for today. Yesterday, Secretary Himanshu sir had talked about the digital exposure for the adolescents in today's time. And on a similar theme, we are getting a few queries. It just amounts to somebody asked, in your experience, how has digital exposure, especially social media, influences adolescent risk behavior in recent years?
Okay, first let me tell you this is a very, very important question, and this we have been discussing over a period of time. And those who work with adolescent will know that how important this social media use is. And many times I have personally discussed with many of the media colleagues and talked about it, and it has to basically to create awareness about this. Number one, we all know that in some countries the social media use is banned, like Australia, where below the age of 16 years. So that's one part of it. And so there are serious concerns all over the world. What we have to understand is social media use and mental health problems, they have the bidirectional relationship. What I mean by this is those who are vulnerable, like those who have a anxiety problem, those who have depression in adolescent, those who have impulsivity issue, those who have attention problem. So they are more at risk of developing going into social media use, because that they find that that brings a solace to them. That's and sometimes though it can go vice versa also, like those who have excessive use of social media itself is leading to anxiety, depression, and so on. So one is that it should not be seen social media use or technology use in isolation. Always I say this. It has to be seen in totality. what the risks are there, what the problems are there, what is the family environment. So all these are important when we. So the message I want to give here is, one, it is the bidirectional relationship. There are multiple risk factors, the vulnerable factors are there, and it will not be correct to just take care of one part of it, because it has to be gestalt. It has to be treated or managed holistically. So if a child has, let's say, anxiety problem, child has a difficulty in talking to seniors, so we have to address that. Because of this, the child is into social media, and in the screen time usage has increased because the child is anxious. So we have to target the anxiety problem as well. Then also, so it has to be, one has to understand. That is why the assessment is the key, the risk factors are the key, what are the vulnerable factors are the key. Accordingly we manage. So the message I want to give here is that yes, it is common problem. Two, it can be managed, it can be effectively managed, it can be handled by involvement. That is what we call as a multimodal management, like where the role of teachers are important, the parents are important, the friends are important, and so on. So based on all this, it can be effectively managed, and we have seen there are good example where many of them have been benefited by the proper treatment and management.
Thank you. Thank you. It was such a wonderful and exhaustive explanation. I think most of you must have got your answer. I have paucity of time, so I'll just pick up one more question. And these discussions will keep happening, so we would be into it. Don't worry, all of you. And one last question, sir, that I'll put up again is very, very interesting. It says many parents find it difficult to discuss sensitive topics like substance abuse, relationships, or self harm with their children. How can we encourage open and supportive communication at home and also even at school?
Excellent point. I think that's a very important point. I wish I could spend more time, because there are and I understand, but that's why I said that we. That's why I deliberately chose this topic to discuss, because to open out, to open. Yes, I agree with the parent. Now, to answer this, I think always I say you have to create that environment of open and free communication. You have to have, and always I believe it's not the quantity of time, the quality time. Like, you can interact one to one, talk about, okay, what is happening in the school, how many friends you met, okay, can we talk about them. Similarly, a mother or father can also talk, okay, I met this person today, we had some interaction. So it's a skill. If anyone wish to interact with me, I can tell, we can play a role model, or some of those things what we do, we can do that. And there are many techniques are there by which, something, ice breaking techniques, some interactions can be there, some so the point is, we understand this is a problem. Two, there are many methods to doing that, because it all depends on what the mental frame of the child is. Is it too resistance is there, then we have to address that. So there are multiple factors have to be addressed, but yes, we need to make efforts to talk to them, make them comfortable, not to be judgmental. Many of the problem what the parent do, they judge a child. If you are doing this, that means he's a bad person, he's a bad boy. Or they try to compare, वो लड़का तो अच्छा है और तुम जो है उसके साथ दोस्ती कर रहे हो, वो तो गलत आदतों में है. Not to judge, not to say all those negative things. Win a confidence of a child is important. Then if you have the confidence, then the child will automatically tell many of the things which he has not told you. So we have to think from the child perspective. I would urge parent to be in the child's shoes, and then see that, then they can interact in a much better communication.
True, very true. And I think we have some very interactive, participants also, sir. Mr. Basu, I think Mrs. Basu has also written, no matter what issues you have with your children, keep the communication always open. Well said, and really, really important. For the kids, we can never, never close the doors of communication. That is, I think, the first and foremost, the priority of we as parents have to keep in mind. So a very good and thoughtful answer. And there are a lot of other issues, sir. Probably we'll have to take an only question answer session with you one of the days, and then just take the questions, because I understand we are, off limit of time. Now I'll request my team, Neha, to please put in a vote of thanks for.
Thank you, Neeti ma'am. On behalf of CBSE, I sincerely thank Professor Dr. Rajesh Sagar sir, Department of Psychiatry and AIIMS team for joining us today and sharing valuable thoughts during the mental health session. Sir, your talk on high-risk behavior in adolescents was both informative and inspiring. So you explained important ideas in a clear and warm manner that truly connected with everyone. Your words made a strong impact and gave us useful tips we can apply in our daily lives. We also thank our respected Secretary Sir Shri Himanshu Gupta for his constant support and encouragement in making such meaningful sessions possible. A big thank you to all the participants for attending. We hope you found this session useful and engaging. Once again, thank you all for your thoughtful and valuable contribution. Thank you.
Thank you so much.
Much.
Thank you. And thank you, the team mate and team CBSE, the unsung heroes behind compiling these sessions together. Thank you so much, sir. Thank you, Professor. Thank you.
Thank you. Thank you. Thank you.